I will say this is an extreme end of the spectrum case, okay? But straightforward cases, just like boring news doesn't sell newspapers. So it does pick up some of the themes, but it is, like I say, an extreme case. So this was, this lad is about 10 now, I think. It was mum's 5th pregnancy. She was a late booker, so she booked at 16 weeks, which is not a particular red flag, but, you know, you've got to scratch your head and wonder why a lady might book late, along with this sporadic attendance at antenatal care. And in fact, this lady had come to 2. She came to the appointments. I guess we should be pleased about that. But 2 of the antenatal appointments she came to, she was intoxicated and was drinking during pregnancy. We were told about 35 units a week. So and these are the sorts of babies we get wind of, because this mum is drinking a huge amount. She's well known to social services. To a degree, she's engaged in the sort of our antenatal pathway, but it is the extreme end of the spectrum. I appreciate that. She also, and I'm going to cover this a little bit later, she smoked, and she also used methadone. So there's a lot of co-pathology in what we see on the neonatal unit of babies that may have been exposed to alcohol in pregnancy, but there's a lot of other things going on that might affect the health of that baby when they're born.